Hi everyone, my name is Jaden Callens and I will be talking about spinal cord disabilities and centering in on one of the many things that are underneath this umbrella term. So, what is a spinal cord disability? A spinal cord disability are brought on by either a disease or injury affecting the vertebrae/nerve in the spinal cord. Paralysis of a portion of the spine is also another possible factor that is the development of spinal cord issues, along with damaged nerve fibers. They can also occur due to hereditary factors, which means if you have a family history of possible spinal cord disabilities, you are at a high risk and are susceptible to it. They can also occur in other various ways. These are some of the most common forms of spinal cord disability: spinal bifida, polio, and scoliosis. There are many other ones that are underneath this, but today we're going to be focusing purely on scoliosis. For scoliosis, what is it? Well, it's a condition found in children primarily and causes the spine to curve in a C or S shape. When a child is young before they hit puberty, the scoliosis is often unnoticeable. But they grow and develop through puberty, and the spinal deformity becomes more visible and can get worse. There are both surgical and non surgical treatments, and it's available to help either prevent the spine deformity from getting worse and to completely, possibly realign the spine. So let's talk about signs or symptoms. For this, spinal, again, it's a small spinal curve. It's often unnoticeable until the child hits puberty. Then you'll start to notice some distinguishing factors. Some of the symptoms are pronounced of ribs on the sides, a tilted, uneven shoulder with one shoulder blade sticking out more than the other, one hip may be higher than the other, or an uneven waistline. So these early identifications are actually really imperative to get ahead because it is a structural issue. So once it's found early on, which it typically is in a lot of these cases, because it's an adolescence, usually the factors will never become severe. So how do they diagnose this? So it is in both male and female, but it's more prominent in the female biological setup. They are genetically predisposed to possibly have a larger angle in the Cobb angle degree, which is the curvature, compared to a male, which they're less likely to have as big of an angle when they do have scoliosis, but it's still possible. So before they actually go into neurological assessments, this is practically fine during a school's like annual physical, where your school nurse would kind of tell you like, oh, like, touch your toes. And if they see like an off curvature, whether that's in the anterior or the posterior, they will get in touch with your guardian or parent figure, and then we'll talk to your medical professional. This is when the neurological assessment will be performed, and a physician will evaluate the curve and shape and the flexibility of your spine. The curvature of the spine will determine the next step. So again, bringing in the Cobb angle, if it is greater than 10 degrees for younger children or greater than 20 degrees for adolescents, which is very rare, the patient will be referred to a specialist. So this can lead to a multitude of routes, which we will get into for how do you deal with this. And just for a little anatomy background, I just want to show the spine and how it can look. So on the far left, you just have a regular straight aligned spine. Then you have the thoracic where you can see more of a upper slight C curve. Then you have thoracic lumbar, which is more of a middle C curve, which is more likely what some people can have. And then you have a lumbar with a lower C curve. And then you have the double curve, which would be known as the S curve. So it's throughout the entire spine. So next we have the effects of scoliosis and exercise response. So, contrary to beliefs, a lot of people with scoliosis can actually still perform regular day-to-day exercises. The only time it's actually affecting one's capability towards exercise is if there is a progression of 30 to 50% of the Cobb angles. So, and that's when you hit adulthood and it truly affects your exercise abilities and health. But again, this has been in the medical industry and what to do for it properly for so long. It never really gets to that state, so it's very rare. So for this, I just want to show some elite Olympians who actually have scoliosis and are completely perfectly fine. So up top we have Usain Bolt, who is the fastest man in the world and has thoracic lumbar scoliosis, so curves on the right. Then on the bottom left, we have Janet Evans, an Olympic swimmer who won 4 gold medals. She also has scoliosis. And then we have one of our rarer cases, which is Natalie Cullen, an Olympic swimmer who was diagnosed with scoliosis at the age of 30. So she's one of the rare situations where it can onset later on in life. But again, clearly you're still able to, with the right structure from physical therapy and possible bracing, or even if surgery, if that's what she got, will be perfectly fine to still maintain a healthy and exercise lifestyle. But the overall goal is of the treatment is to keep the spinal curvature below 50 degrees. After that point, the only way to stop the curvature will be in the progression during surgery. So let's talk about management and medication. So for scoliosis, it's honestly more so just a mechanical problem. There's really no need to have like medication. It's very rarely like anything like prescribed. A lot of the stuff is honestly over the counter. So again, depends on the spinal curvature of the underlying condition, if it's a C or S curve, but typically this is diagnosed during adolescence and doesn't really require like medication. And severe makeup only like very rarely, it's like 0.1% of the US demographic. So again, like I made mention earlier, of over-the-counter drugs could be like ibuprofen, and in very rare cases like opioids, which really aren't looked at to prescribe because, again, one of the side effects could be possible addiction. But with the other over-the-counter drugs that help just with like pain relief in a lower back, it just causes like nausea, stomach pain, dizziness, not anything drastic that truly will affect possibly creating a workout routine, their exercise and health. A form of managing it for the severe route, again, if they hit that 50-degree angle, will be a surgery route. So if you look in the top left corner, this is the Harrington rod, and they also is another procedure with the pedicle screw, but basically it's a surgery where you have to have screws aligned to straighten up your curvature of the spine to realign it again if it's a severe angle. Now, for the bottom left, we have the lion method, which is basically you're sitting on a medicine ball and your physical therapist will try to help you with like your spine, like alignment and body awareness for your posture, which body awareness and spatial awareness for the posture is actually very key during physical therapy training and different exercises and requirements. For the left, this is the C's method. So basically, again, this just goes with like body awareness and adjusting. It just teaches you how to properly adjust yourself with sitting down and standing up and like how to breathe to make sure your body is in proper alignment. So it keeps you aware of your space and your alignment. For the right side, we have like the brace. The brace is something that is basically given like very young adolescents. There's a multitude of different ways you can have a brace made. You can have some that in this picture come along more of the chest if it's more of an anterior. Typically S curves cause more of like a shoulder tilt and hip, so theirs is more like elongated, whereas say if it's like a C curve, it's more in the lower lumbar. The brace will only like be around like the torso area. But this is again worn from adolescence all the way until basically the end of puberty when you're done growth. So that's like when your spine stops adjusting. So you're wearing it throughout the whole entire time to help keep it locked in. For our case study, we have Nicole. She is a 26-year-old female who wants to gain better form and technique in her exercising because she has scoliosis. Along more in-depth techniques that could aid in her spinal cord condition. As of right now, her main form of exercise is cardio, primarily outdoor running and little to no weight training. She's currently not on any medications for her medical issues, but has used a back brace in her adolescence to aid in fixing her form and posture. She has an S-shaped curve, and since her scoliosis was detected earlier on, her Cobb angle did not become severe, requiring surgery or PT. Her blood pressure is 120/80. She does not smoke and is a full-time dental hygienist working 4 to 5 days a week. Her goals are to gain more knowledge of lifting weights with scoliosis, possibly modifications, and become more comfortable with other forms of working out. Risk factors, again, it depends on her type of scoliosis, curvature, and degree. We would have to get more in depth with her medical like care and physician, which leads to her needing medical clearance. A lot of like cases with scoliosis, you do still need medical clearance. For special consideration, we would have workouts to keep spine flexible in opposition to muscles that need to be strengthened and really focus on core strength. Stabilization of the core is very prevalent in a lot of workout routines and physical therapy practices done for scoliosis patients. So for our exercise testing, I will be doing for her aerobic a modified bruise coat protocol, even though she is an avid runner and she's very familiar with this. Is why, again, I want to try to do a more treadmill based, just because, again, we would have to know with her physician, are there any limitations that we do need to know? So I'd rather just already have it be in a modified state just in case anything does need to be edited. For muscular, I decided to do a submax low impact, so 5 RM. And this is just because she has little to no experience with weight training, so I didn't expect her to be able to go to that much because she's also not familiar with form, and her alignment of her back can also be a variable depending on that. With that being said, for upper body, I decided to do bench press because she'll be able to lie down on her back, which is really beneficial for scoliosis patients, and will be able to keep her form in alignment. And then for lower body, I decided to do kettlebell suitcase deadlifts. A lot of ACE recommend suitcase deadlifts with kettlebells, again for alignment, which is very key and big for lower body workouts. So I decided to do that for her 5RM. Then for range of motion, I just decided to do goniometer because it's gentle. We don't want to cause any discomfort. For her exercise prescription for aerobic, I decided to do 3 to 4 days a week because, again, she's avid, but I didn't want to do complete 5 days because we are now introducing resistance training, which is something she's not used to. For intensity, RPE of 15 to 18, where she was at, and then time 30 to 60 minutes again because she is an avid runner, so she clearly does have a good endurance. For type, I decided to actually not stick with her running, though that very much can still be incorporated in her routine. But I want to introduce something new, such as swimming, because swimming is actually very big in a lot of research articles for scoliosis patients for aerobic health, because it basically doesn't allow as much pressure onto the bone. So because of gravity, it's more free. And to benefits with doing backstrokes and breathstrokes help with gaining muscle in the back. But if she's not familiar with swimming, another alternative could be water aerobics, which is, again, more beginner friendly and it still works out. For resistance, I decided to do 2 to 3 days a week with intensity of 40 to 60 of the RM. For time, I decided to do 3 to 4 sets of 8 to 10 reps. I really wanted to prioritize core stability because that's such a big thing for back alignment and postural awareness. So I have hanging from a bar, to strengthen up your core. I have dead bugs because that also helps you realize your alignment and your form. I have kneeling, standing, anti-rotational, which is done with the cable machine or it can be done with a weight when rotating. I have the 3-point dumbbell single arm row. Again, with strengthening the back and detecting any type, it'll allow us to detect any type of imbalance basically for her because it focuses on each side. Then we have the kettlebell suitcase deadlift. Again, I decided to go with that because it seemed to be a fan favorite amongst articles for lower body workouts. And I actually have Pilates, which I really want to be the key of her resistance. One, because you can do it at home because there actually are a lot of YouTube videos on Pilates for those with scoliosis and it's free in case it is a financial issue. Or B, because she could go to a Pilates class and a lot of instructors are actually very knowledgeable on the alignment of the human body and how to help better that, which I think is very key and important. Along with being gentle and it can be done sitting or reclining or lying down and it's low impact and it strengthens the spine. Lastly, for flexibility, I decided to do 1 to 2 days a week, RPE of 8 to 10, but basically to the point of slight discomfort, but nothing too crazy. 30 to 45 minutes, and I decided to do yoga because yoga is actually really good again for just awareness. And there are also YouTube videos on yoga specific to those with scoliosis. And just stretching is very important for spinal flexibility. Well, with that all being said, these are my works cited sources, and thank you for listening.